Dr. Bragg with a tip for a pain-free Friday. Today I'm going to talk about SI joint, sacroiliac joint pain, because this is a common cause of back pain, which is often misdiagnosed. And this pain occurs in the lower part of the back on either side of the sacrum. It is very common, yet it's often misdiagnosed. Why? Because this is a clinical diagnosis. This is not something that the doctor needs an MRI for. This is something that is important that you describe your pain to the doctor, help him or her to know where it's located, and together you're able to diagnose that is in the lower back, and it could be your SI joint. SI joint pain is common in women during pregnancy. It's also common after a fall, a motor vehicle accident, any kind of trauma. And people usually may have pain in the lower back, and it can also be present in their groin or in their thigh. The pain is usually worse with standing and walking and improved when you're laying down. Now, this can occur as an effect of aging when their SI joint can become degenerative. So these are just some of the common causes of SI joint pain. But how do we diagnose it? We can diagnose it by doing an injection right in that SI joint, which is a small joint, and you usually do it under X-ray guidance, which we call fluoroscopy. We can put lidocaine, which is the anesthetic that the dentist uses to numb you, and we can put that in that joint. And if you get pain relief, it helps us to do two things. It relieves your pain, but more importantly, it helps us to diagnose that it is the SI joint that is the source of your pain. And if that diagnostic injection is positive, we can come back then and do an injection with corticosteroid, the same steroids that we use injections in our shoulders and in our knees to give you some relief from the inflammation of the SI joint. And certainly there are exercises that you can learn from your physical therapist to help you to manage your SI joint pain. And if you don't have any contraindications, you can always take an anti-inflammatory to help with some of the inflammation and use some icing after you have that injection. But my point here today is the SI joint is not something you have to run and get an MRI, because the MRI is not going to tell us any information about the SI joint. We want to do certain maneuvers when we do our examination that are SI joint tests that help us to know if the SI joint is causing your pain. These are what we call provocative tests that will increase your pain in your groin and in your thigh and will help the doctor to know that it is your SI joint. So please share this video with a friend, and I hope that if you have SI joint pain, that you are able to explain and describe your pain with your doctor so that he or she can diagnose it and that you can get relief from this condition that is easily treated. So please subscribe below.